Good evening, everyone. Welcome to General Practice and the NDIS Eligibility and Evidence. I'll begin with acknowledgement of country. I would like to acknowledge the traditional custodians of the land on which I work and live and recognise their continuing connection to the land, water and community. I pay my respects to elders past, present and emerging. A little bit of housekeeping tonight. You know, we're all meeting virtually. We've been doing this for about 14 months now, I would say. So, you know, all attendees will be muted, but there is a question box. So please pop any questions you have into the question box and we will try and answer them online, but we will stop if there's anything in particular and you want to have a discussion. There's a small group meeting tonight, so we'll be more than happy to have a discussion about anything you want to you know, discuss. And this session has been will be recorded, but we won't be recording the end part of the session where we will be having a Q&A. Just a little bit of, you know, what's happening with us in the next month or so. So we have a few education and training sessions. These will all be virtually at this stage. So there's Community of Practice, Family Violence on the 28th and 29th of April, 6:30 to 8 p.m. Using digital health technology in the COVID environment, 11th of May, 7 to 8. 11th of May again, we've got Demystifying Dermatology by Western Health. By the Royal Victorian Eye and Ear Hospital, we have Common Causes of Visual Loss in Australia throughout the lifespan. So that's the 18th of May, 7 to 8. Addressing Influence of Obesity of Pregnancy in Improving the Health of Women and Their Offsprings by Western Health on the 25th of May. And then we have, again, the third session of this series. So this is the second session, and that will be held on the 1st of June, so General Practice in the NDIS, and it'll be Update on Independent Assessments, Part 3 of the series. If you go to our website, you'll find a lot more education and training sessions that we have. So it's nwmphn.org.au/events for more information on that. Something that we'd like to remind everyone is this amazing tool. If I go back, our health pathways. At the moment, this tool is, you know, I have a lot of GPs that I speak to and nurses, and it's got over 750 pathways for GPs to use at point of care. You can see there our presentation has got all the COVID pathways. Amazing resource. So if you're interested in using it, contact us. Visit melbourne.healthpathways.org.au or request access by calling us or your relationship manager, and we can organise for you to have access to all. It is really worth having a go with Health Pathways. Then we've got Think Tank. So if you are interested, if you would like to collaborate in future PHM projects, if you have specific interests in key areas such as practice manager, human resources, quality improvement, clinical topics, and, you know, diabetes, pediatrics, NDIS, join our think tank and be the first to hear of opportunities and get involved with the PHN. So if you go to our website and search Think Tank, and you'll get more information on how you can engage with us that way. And I would just like to introduce our presenters. So we have Seb Papadimitriou, I think I got that right. Seb is the Senior Manager for Early Childhood Early Intervention Team for the North East Metropolitan Area, so NEMA. This team covers the local government area of Darebin, Yarra, Nillumbik, Whittlesea and Banyule. Seb joined the Brotherhood of St Laurence in early 2017 as part of the first early childhood team to roll out under the NDIS. We also have Julianne Robbins. Julianne is a Senior Local Area Coordinator with the Brotherhood of St Laurence NDIS services in the Darebin and Yarra LGAs. Julianne's experience in the NDIS space commenced with a role with the National Disability Insurance Agency in 2016 and has included working with NDIS Quality and Safeguards Commission before joining the Brotherhood of St. Laurence team in 2020. So welcome everyone. Remember, if you have any questions, please, pop them into the question box, and let's have a good evening.
All right. Going to start sharing my screen now. Hopefully this is working. Bear with me. Hoping everyone can see my screen.
Yep.
Perhaps Yvonne or Seb could let me know if that's working.
Yes, we can see it.
And wonderful.
We can see it. We can. Do you want to do it as a slideshow?
Yeah, perfect.
We
Let's
can
do
see
that.
Amazing.
There we go. Thank you. Very good. And thank you for those who've joined tonight, and for anyone who's watching later this presentation later on. So I'm not sure how many of the people who are here at the moment joined the first session, but I suppose initially we'd just like to introduce again Seb and myself. We have quite different roles here at the Brotherhood of St. Laurence, and tonight we'll just talk about the different areas. We would also like to acknowledge the traditional custodians of the land on which we're meeting on, and the lands of anyone who's attending away from this area. Pay respects to elders past, present and emerging, and extend that respect to Aboriginal or Torres Strait Islander people who might be on this session tonight or watching in the future. As we've said in the previous session, the NDIS is ever evolving, changing quite quickly. And so I suppose it's important to note that the information we're talking about tonight has come from the NDIS website and from other sources within NDIS resources at its current right now. However, it does change. So the NDIS website being the point of contact with the most up-to-date information at any time. And we're also available as well. So at the end of the presentation, some information for our contact details. We've got numbers that come direct through to duty officers. So don't ever be afraid to give us a call, get in touch. Or just send either Seb or myself an email if there's any specific questions that you didn't want to raise tonight, perhaps if they're about individual situations that we can provide some guidance or advice on. Just to really quickly recap, given that it's a small group and some of you might have attended the previous session, just to recap on that first session. The details that we covered off in that previous session was really the models of disability and the history of how the NDIS came to be, the evolution of the process that got us into having the scheme across Australia, and some information about the previous system that was in place within each state, and some of the challenges that the previous systems had. The previous session also covered off on information about the pillars of the scheme and its insurance principles, and also focused on the terminology of reasonable and necessary supports. So what it is, in fact, that the NDIS can fund, and that terminology or that section of the legislation that talks about reasonable and necessary. All right. I can't see others in the room, so please, Seb, if you would like to jump in or have other thoughts to share at any point, please go ahead and do that, but I can't see the screen. Great. I've just got my slideshow up. So who are we at BSL, the Brotherhood of St. Laurence? We work obviously really hard in the NDIS space, but BSL more broadly do a lot of other work outside of the NDIS area. So working to create Australia free of poverty for this generation and futures, fair, compassionate and just society. So we have a large number of programs that are helping people and communities to overcome a whole range of different types of disadvantage. The Brotherhood of St. Laurence is in partnership with the NDIS. So we're partners in the community, and that's a term that's used a lot in NDIS. So we deliver that service as partners in the community in Melbourne area, so the area where Seb and I are working. Bayside Peninsula areas, Western Melbourne and Brimback Mountain. So we deliver early childhood, early intervention for children 0 to 6 years old. So that's the area Seb works, and we'll talk more about. And local area coordination for people who are from 7 to 65 years, and that's the area I work. So there's some differences in the processes. The NDIS recognise that the Brotherhood of St Laurence are able to facilitate community connections and support. This presentation is really going to delve a bit more into the depths of the access request processes and the work that you would do as health professionals in providing information to the NDIS, and we'll separate that conversation, I guess, at different points during the presentation where there are some differences in process. But for local area coordinators, so the 7 to 65-year-old participants or people coming into the scheme, the role of the local area coordinator or the LAC is a combination of things. So it's pre-planning and planning, so community engagement and awareness, linking people to community and mainstream support, so that focus is really broad across all areas, not just NDIS funded services. Assisting people with access inquiries. As I said, we've got duty officers available at any time when they in the office or by phone, by email. You can get in contact with us if you had a patient who was trying to access the scheme and needed some advice, or if you needed some advice directly about filling in access requests or what types of evidence would be helpful to your patients. We also do planning conversations. So once someone's granted access to the scheme, we would be going through a whole range of questions and information with them about what their life is like, what sorts of supports might be meeting that reasonable and necessary criteria. Once they have a plan, we do plan implementation. So talking to people about how to access supports and connecting them with the funded support service providers, as well as community or mainstream services. And then we provide ongoing support throughout the period of their NDIS plan. So our approach is always around capacity building, walking alongside, helping people to get that plan working for them to help them reach their goals. Another big component of the work that local area coordinators do is called ILC, so information, linkages and capacity building. We sit on a range of committees and organisations. We attend a whole range of meetings. We're actively involved in some of what we call mainstream interface. So we would talk at schools, for example. We would do presentations like this. We would be trying to make sure that people across the community, whether they're accessing the NDIS through funded supports or not doing that, that they can be connected to services and supports that can assist them.
I guess, Julianne, I'll just add in there that the role of the ECI coordinator is everything that is noted there for the LAC, except that the differences between our roles really sits in that access component, and we will go into a little bit more detail as to what that means for the ECI team in supporting children aged 0 to 6. And their families, yes.
Right. This is just a little visual representation of what we just spoke about. So from access to pre-planning, a planning process, implementing the plan, and then going through a review. And really it's a cycle. And it could be any length of cycle as well. So you may have been familiar with plans that are typically 1 year in length. That can vary and is varying over time. Okay. All right. We did touch on this in the previous session, but for those who weren't there, eligibility requirements. So this is for local area coordination, so the 7 to 65.
It's the same for us.
Same, great, yeah. And, oh, sorry, Seb, go ahead.
It's the same for us. The eligibility requirements are the same.
Yeah. And obviously person, Australian citizen, permanent resident or special protected special category visa holder. And the person needs to meet the disability requirements as outlined on section 24 of the Act. And I suppose that one's highlighted and important from the perspective of information from treating health professionals, because the questions that are asked on the access request form, or the questions that you'll really be addressing when you're providing information, relate to that section of the Act. The other way that someone may meet eligibility is if the person meets the early intervention requirements as outlined on section 25 of the Act. So the disability requirements, so section 24, this is each individual breakdown of that section. So the person who's applying for NDIS access has a disability that's attributable to one or more intellectual, cognitive, neurological, sensory or physical impairments, or one or more that's impairment attributable to a psychiatric condition. That the impairments are or are likely to be permanent. The impairment results in a substantially reduced functional capacity, and the impairment affects the person's capacity for social or economic participation, and that the person's likely to require support from the NDIS for their lifetime. So that is the type of information that's needed on those access request forms, and the questions really guide towards that. The access request forms online, and it has actually recently been updated. It's something you can actually now go into online and complete online, even with a digital signature. So it's I suppose an easier process than previously, where a potential participant needed to call the NDIS to have a form sent out. That terminology around attributable to impairment, so for the purposes of becoming an NDIS participant, it's around the reduction or loss of an ability to perform an activity which results in the impairment. So when assessors are, NDIS access assessors are looking at that, they're not concerned with what's caused the person's disability. The impairment caused by the condition is not the condition itself needs to be declared as likely to be permanent. An applicant doesn't always need to try treatment or interventions, and this is a really common question that many people who are talking to us for just general information or advice ask, because there might be some treatments that could be available. If they're not suitable treatments for that person, documenting that information on those access request forms is really helpful. Just reading that information, it says, however, treatment or interventions must be explored to the extent that clinical recovery is no longer likely, and that ongoing treatment is instead centred on personal recovery. So there's quite a bit of terminology around this in the Act and on these slides, but the access request form is quite clear in talking about functional impact. So rather than just diagnosis names, talking about the actual functional impact, how it impacts that person's day-to-day life, is broken into a range of sections. Okay, permanency, I suppose the term is relatively self-explanatory. The form does go into the information about how long you've known the person who you're completing the access request form for, how long their impairment has been evident. The age of the person is taken into account in some of these things in terms of appropriate development. One of the examples that we would see from time to time particularly is around psychosocial diagnosis or mental health diagnosis, particularly if someone's quite young. given that they may not have had an opportunity to explore a whole range of treatment options to be able to determine if that's actually a lifelong, that diagnosis is going to have a lifelong impact for them. Again, permanency is around exploring treatment options, and if further review is required to determine permanency of the impairment. So there might be other contributing factors, and in this example on the slides talking about alcohol or other drug use, for example, could be something that impacts further. Okay. All right. These are the areas that I was mentioning are outlined on the access request form. So it gives you an opportunity to talk specifically on that document, and you can be quite short in terms of the answers, but just really we've got the diagnosis further up on the information. So this is the opportunity in these areas to talk about the impact on different areas of someone's life. So there needs to be considered to be a substantially reduced capacity in at least one of the areas, not all of the areas. So don't be at all concerned if there are some areas that there's nothing to write or only a small amount to share. So, for example, you might be saying in regards to someone's mobility that their balance is impacted, based on your knowledge of the person, that their ability to walk is 50 metres, for example. So talking about the tasks that they're not able to complete independently, and then also making any suggestions around supports might benefit them in that area. So, for example, it could be the provision of a walker, for example, or a piece of equipment in each of those areas. So mobility, fairly self-explanatory. Communication, and that could be in terms of their verbal communication, but it also could be around their ability to communicate with friends, family, ability to remember information, for example, and communicate. Social interactions, thinking about their person's ability to engage in a whole range of community events, learning, any maybe impact on literacy and numeracy, participation in education, and self-care, self-explanatory again, but all of the day-to-day living skills, life skills, and self-management, really around those broader things around organising and managing everyday life. All right. As with all of the other sections, these definitions relate to different sections of the Act. So as I said, it's around having substantially reduced functional capacity in at least one of the areas of the 6 domains. The tips, just giving details of the functional capacity over a period of time is useful, particularly if a person has fluctuating needs. So considering the results in substantially reduced functional capacity when completing those everyday life activities or different areas of the domains will help the NDIA consider what happens between acute periods. Okay. It is a little repetitive, but for a reduction to be considered substantial in the domains, it's about documenting or showing that there's an inability for effective function within the whole or majority of the domain, not just a singular task. So examples you would think about, if someone is not able to turn on taps to shower, for example, it may be that they can do a whole range of other things well and easily, but it might be that one thing takes a little more effort, for example, so that may not be considered a substantially reduced functional capacity. And by itself, reliance on a commonly used item to complete a task generally wouldn't be considered substantially reduced. From the operational guidelines, and there are a lot of them that have recently been updated on the NDIS website, a person will be considered to be unable to participate effectively in an activity if they cannot safely complete one or more of the tasks required to participate in an acceptable period of time. So undertaking a task more slowly or differently to others wouldn't necessarily mean that a person can't effectively complete an activity. Okay. So for people who might have been in the previous session, we spoke about pillars of the scheme. So the reasons the scheme was developed, and one of those is around economic participation. So when we're developing plans and including funded supports, just as same as the assessment at the start that grants access to the scheme, the NDIA need to be satisfied that the impairment impacts the person's ability for social and economic participation. So that statement again from the Access Operational Guidelines there really talks to the idea that an impairment needs to be considered to affect a person's ability to be involved in social or economic participations. Therefore, people who retain substantial capacity may still access. So one way we would look at this is someone might need support to be able to attend to their personal care needs while in employment, but absolutely be able to continue and maintain that work. So there might be something that has a significant impact on their day-to-day life in that area of potentially mobility or self-care, that without the support on that area, their ability to be involved in economic participation would be impacted. And the final point of the access information is talking about lifetime support. So if, for example, a condition is what the NDIS would consider a health condition, in the previous session we spoke about List A and List B, and we'll cover that in a moment, would be most appropriately funded through other services, so some of those health systems, as I'm sure you're all familiar with, then the NDIS wouldn't be taking responsibility to make payments or provide supports for health-related services, and then other services would pick up or to do those things. All right. So in the evidence section, Seb might provide some information as well about evidence from an ECEI, so early childhood, early intervention perspective. In terms of this slide, evidence recent, completed by a relevant treating health professional, describing future treatment options and expected outcomes, and confirms primary disability, and it may also list other disabilities that have an impact on the person's day-to-day life or functional capacity, describes previous treatments and outcomes, and confirms the impact on the person's day-to-day life using examples.
In terms of ECI, so these would also be considered good evidence. I guess the difference, and when we move into the ECEI part, into the early childhood part, we'll actually go through that a lot of the providing of evidence for access is actually supported by the ECI coordinators, and that's, I guess, one of the differences between the LAC and ECI team. So, but certainly this evidence would be considered good evidence as well.
Yeah, wonderful. I'm going to try and swap my screen here, so I hope I don't lose anyone or anything. I'm going to just pull up the website. I'm hoping you can see it now.
No. Yes. Yeah, we can see it, Joanne.
Fantastic, thank you. I'm just sharing the information from the NDIS website here. So as I said, the access request form changed probably around 6 to 8 weeks ago. It is on the website now, and it is an electronic version that you can complete. So you can do an electronic signature And you can absolutely access a whole range of information for GPs and treating health professionals on the website, including information about Medicare billing in relation to the time taken to fill these access request forms in. So if I just click into the form here, I'm hoping I can bring this up. Great. So some of you are probably familiar with this form. It is something that can be easily completed online. It asks for a range of information about the patient or potential participant, and then goes into the sections that really cover off on each section of the Act. Main or primary disability, if there's any additional disabilities to be listed. Questions around caused by an accident or event through the NDIS process. If there is compensation involved, the person would provide some information around that. They would be asked some additional questions about that. It's just really around making sure there's not a duplication of supports, that the NDIS is not able to duplicate funding. So if something was being provided through an insurance of a different type, that would be included, the information there. Again, like I said, it can be an electronic signature. And moving on to the section of your own details, outlining different areas about potential early intervention support needs, or any other assessments that have previously been completed, and they can be attached to help give more details about the person's situation. All right, I'll just flick back to my screen now to get the presentation back up. Can you see the presentation again now?
Yeah, we can.
Yeah.
It's not in slideshow, but it's there.
That's all right. Thank you. Fantastic. We'll get there. Good.
If you click from current slide.
Current slide.
Yep. If you do slideshow from current.
Beautiful.
So
Thank you. Help. Oops.
Next one along.
There we go. Thank you. Great. Thank you. All right. All right.
I think you've got to click resume slideshow, possibly. Can you see that on the providing evidence bit?
I can, sorry, there we go.
Yeah, cool.
Thanks very much for the technical support. All right. So I think we've gone through in a quite a lot of detail. It's quite heavy on the technical and legislation information, but providing evidence just to finalise those sections. Other things that can be helpful if there is some financial administration or guardianship orders in place for a person. If you've completed any other reports or information for example, disability support pension, carers allowance payment, some of that information can be helpful and already available from your own records. Again, copies of any assessments, reports or other information, of course, that the person's happy to provide, and any functional capacity assessments that have been completed. Good. We'll just move into the section that really talks specifically about early childhood, early interventions. I'll hand over to Seb.
Thanks, Julianne. I guess one of the in terms of our roles, they are very similar. However, in the early childhood, early intervention part, when we receive referrals or applications to our service, it is very much about a specialised pathway for children, 0 to 6. And this, and you may have done it in the history where the LAC team actually were supporting participants 0 to 65, and then it was recognised a little way down the track, probably about 6 months later, that a more specialised pathway for children was required, and the NDIS did develop that. So I guess one of the things to note is that the pathway for early childhood, early intervention, when you're putting in an application or a referral for our team, you are putting it in for our team and not for an NDIS application. So part of our role is actually to support those different pathways. So not all children that are referred to the early childhood team will receive NDIS funded supports. And the reason for this is that a big part of our role is actually really about understanding. We often talk about the right supports at the right time, and for some families and children, the right supports at this time might not be funded supports through the NDIS, but it might be about supporting them to access the local kindergarten and have those opportunities to be with other children, to be able to develop skills within their natural settings. So it does, our work is varied, I guess. So in the early childhood space, it does recognise that developmental delays and disabilities take time to diagnose. So where Julianne spoke about that after the age of 7, that there is a requirement for accessing the scheme under disability or early intervention. For early intervention children, so under the age of 6, it really does focus on not on the diagnosis as such, but rather on the functional impact. So it's I guess an even stronger component, because we do recognise that those functional delays are often showing up in children, and families sometimes may not want to go down the pathway of a diagnosis, or they may not be ready to hear that conversation. For some families, it really is about, or for some children, it's really about ensuring that they've got those supports in place to ensure that they don't, that timely access, I guess, is really important. So for the children that we see, that more often than not, they don't have a diagnosis, but it really is about supporting those early supports under the age of 6. Our team are all from childhood backgrounds, so we have varied professionals, such as speech pathologists, occupational therapists, social workers, physiotherapists, and educators who have who specialise in working with young children. The team, and the reason we have these qualifications or backgrounds is so that we actually do provide, if NDIS funded supports is the pathway, then we provide that evidence in terms of the functional delays or the developmental delays that may be apparent. There are some children that do are referred to us who do have a diagnosis already, and depending, we'll go into at the moment the NDIS has lists of that you can meet access under particular lists. So for ECI, it's the same in terms of those lists. The only additional lists that we have are, well, actually we've got 2. So there is under developmental delay, and also we recognise there are some diagnosis that we know that early support is essential, and that the therapy support is really essential in those early years in order to really support families. And diagnoses such as Down syndrome would be one of those, but we do know that the early intervention is important, but it may not be required, like ongoing support may not be required after the age of 6. So there are some diagnoses that are a part of that. Julianne, can I get you to flip to the next slide? In terms of early childhood, early intervention, I guess one of the big components is that best practice is the foundations of the early childhood approach is based on best practice principles, and you know, one of them being that timely access to early childhood intervention is vital, because we do know that the brain develops the most in these early years. So we really do want to make sure that that support is provided when the brain is nice and pliable, where lots of those different skills can be built for children. In terms of the research, that also backs it in terms of, trying to achieve the best possible outcomes. So it really is important there. In terms of the NDIA and our best practice principles, the ones that we tend to focus on are the key worker model, which is really about having one person coordinating all the different services for the family. A family-centred approach, which really focuses on families, say carers or family members being the most important person in that child's life, and really understanding to start where they're at, so where the family's at. In terms of strength-based, it focuses on building on the skills that already is part of that child's life. Natural environments is really around understanding that children learn best in their natural environments, and so things in their, for example, any sort of capacity building work that we would do might happen out in the community. So it might be, if the functional impact is about a child not being able to go to a shopping centre, then the work would happen there. In terms of also supporting them within their home, within their childcare centre, within their kindergarten program, within their school program, it really is, really identifying that children learn best in their natural environment, and when they've had that opportunity to, those additional opportunities to continue to develop. Capacity building goes across both LAC and ECI, so that's where it's really about building the capacity of the person. So in our case, in early childhood, it really focuses on the child, but as well the family or the parents or caregivers for the child. And again, Julianne already spoke about, accessing and linking to mainstream and community supports is really an important part of our work in terms of supporting families in the community. When families or children are referred to early childhood team, they meet with an early childhood partner or coordinator. So that's our team that we have, and as part of that initial visit, they really try and gather information about the child, and it's things like what happens each day, what's happening in terms of all the different developmental areas, what's working well for the family, what have they tried before, what are the outcomes, also thinking about, what are they already involved in. And part of the early childhood coordinator's role is really about putting all that information together and then supporting the family to make decisions about what the right supports for their child and family might be at this time. And, when you think about that, it really is around one of those pathways might be the NDIS funded supports, and in which case we would support that access. So the access request form that Julianne showed, we also have a form, but it's for children under the age of 6, and we would support families to complete that. There are also, part of our role is also, we can also do a verbal access request, so we can do that directly with the NDIS and the family. And the other big part is that information that we've gathered, we put together a report to show what that functional impact is. So where Julianne described in the access request form that it requires treating professionals to complete that, in terms of the early childhood, our team would be providing lots of that information. And naturally, sometimes some of that information already comes from health professionals. So we would be certainly building on whatever we've already received that the family has. In terms of the next slide, thanks, Julianne, that the early childhood coordinator or partner really does help to, as part of that initial visit, but also if we move into that planning, we certainly look at what the family identifies goals for their child and what support needs. And again, it's really about building on lots of the different parts that are already existing. So I guess there's lots of pathways that come off that initial meeting, and some of that might be short-term supports. It might be access to the NDIS, and it might be linking them back into their mainstream or community support. So there are lots of different options, and I guess part of the early childhood team is to support the family to be making decisions about those right supports for them. Over to you, Julianne, on the next bit.
We are getting close to the end of the information, but we absolutely have some time for questions at the end. Yeah, we mentioned earlier in different sections about lists and lists that relates to diagnosis or conditions that people might be looking at accessing the scheme to provide supports around. So there are two key lists for conditions. So list A refers to conditions that are likely to meet disability requirements where there's clear diagnosis from appropriate specialists or legal professionals like yourselves, where there's a level of severity that really predetermines that something is going to meet those section of the legislation that talk about permanent, ongoing, lifelong supports being required from NDIS. So you can see there things like moderate, severe or profound intellectual disability, autism level 2 or 3, cerebral palsy, amputation. So if you think back to the access request form we were looking at, where it had a list of the different types of assessments or reports that could be attached or might have been done previously by yourselves or other health professionals, you can see that there's a link between these. So the list, for example, included DSM criteria around intellectual disability or DSM level related to autism diagnosis. Audiologist reports around around hearing loss, for example, gross motor function scales for cerebral palsy. So list A, again, it's really the diagnoses that people would be most likely to meet those eligibility requirements.
With these diagnoses, yeah. And I guess in terms of ECI, whilst we put together the evidence for developmental delay, we still require health professional reports for any diagnosis that fits under list A. We also require it for list B, and these conditions are, if you noted on list A, it was around intellectual disability being moderate, severe or profound. In the list B, the intellectual disability would be mild. So there are list B, there's the recognition that they're permanent. However, that functional capacity will vary amongst people. So it, in terms of the list B, even though the condition or that there might be a disability diagnosed, it's really about that functional capacity that will determine this component. And again, it does need a report from a health professional in that sense as well. In terms of if applications are rejected, so if an LAC has supported a family in terms of requesting access, and also with ECI, there is still an option for getting support from an LAC or ECI partner to be able to support people to be able to get the evidence that's required. So the NDIS certainly makes it very clear in their letters what component or what additional information they might require, and the LAC or ECI partner can certainly support the family to find out where to get that information. If a family or a participant thinks that the NDIA decision is wrong, or they don't agree with the decision in terms of access not being made, they can certainly request an internal review. And it's still not happy, there's like different levels that you can move up. So the NDIA reviews it, there's an internal review, then they do an administrative appeals tribunal review. So that's outside of the NDIA, and I guess well, there's a note there in terms of submitting an entirely new application. What we have found is that process has certainly improved, and so really talking to the partner would best support the participant or family in being able to get the evidence that they require. So the next part is there are some helpful resources, and I guess there's some links there in terms of what can support you in supporting the patients that come and see you. So access to the NDIS operational guidelines, which does go through that List A, List B, as well as the developmental delay criteria. There is information there for GPs and health professionals, the evidence of psychosocial disability form and other psychosocial specific information, as well as the mainstream interface and the COAG agreements. So the mainstream interface is things like the interface between health supports and NDIS, education and NDIS, and that helps to determine who will support the family with different components. I guess one of the things where Julianne spoke about at the start, that this is the information that's correct at this time. The NDIS has undergone a number of reviews, both within the LAC space as well as the ECI space, and we are seeing changes coming through. So there could be potential changes to the age range. So they are recommending that for early childhood, early intervention, we're actually going to be seeing children up to the age of 8, in line with World Health Organization definitions of children. Also, there are, in terms of the operational guidelines, some of those are changing in terms of the List A and List B, and developmental delay are current. However, they are looking at some changes in terms of being in line with independent assessments, although they have been put on hold at the moment. So there is some changes that will be coming, but I guess there's some that are unknown. So I guess this is the information we know at this time. Well, that's the end of our contact numbers. So there is, regardless of whether you either of those 1300 numbers are now going through to the same line, so it will be answered. They get triaged at that point, and they do come through to either a duty coordinator, an intake team, or intake and linkage. So in ECI, we have a third component there. So your call will be answered by someone that has the relevant information, and if they don't, they collect it and get back to you. So be assured that that 1300 supports all inquiries. The ndis.info@bsl.org.au is specific for all age groups. The ECI.access is more specific for the 0 to 6 age group. However, it doesn't matter, send your inquiries through and we will definitely triage it if it's gone to, there's no wrong door in terms of inquiries at the Brotherhood. And there are our emails as well in terms of if you've got more questions, like Julianne said, if you don't have the opportunity to ask tonight. or think of something a bit later.
Great.
Right.
Great. Thank you so
suppose,
much, Seb and Julianne. Really informative information. Seeing we do have a small group, do we have any questions? If you want to put your hand up, we can unmute you and you can ask Seb and Julianne directly. This is your opportunity. You've got their undivided attention for another 15 or so minutes. So please feel free or pop a question in and I'm happy to read it out. But otherwise, we will be sending an email out tomorrow with a link to our YouTube channel where the recording will be uploaded in the coming days. You also can follow up with the evaluation survey that we'll be sending out to you tomorrow, and just put any questions you have in there, or if you need someone to contact you. Like we said, Julianne and Seb's email addresses are there and they're happy for you to send questions directly.
Yvonne, if it's all right, I'd just, I suppose in summary, one of the things that I'd really like to reinforce, I suppose, in all of that information is if you're seeing a patient or you're speaking to a family, regardless of whether or not they are starting to explore an NDIS access process, have an existing NDIS plan and have questions, or have had an access request that's been rejected and need to know where to go, please don't hesitate to either direct that person to contact us or to touch base with us yourselves, because we're certainly here to help with all of those things. And the other thing would be that we had a three session series of presentations. As people might know, and as Seb mentioned, there's some current changes around the decision making about independent assessments and those things. So our session 3 is still a few weeks away, and its aim is to provide an update on what might change in the systems in the future. But if you're filling in that feedback survey, or if you'd like to shoot us an email and make any suggestions about other things that you'd like to hear covered off in that last session, please let us know, because we'd like to hear what it is that are the common questions you're hearing, or common questions you have, to be able to address those areas in the next session as well.
Amazing. Thank you, Julianne.
Thank you.
All right, so we actually don't have any questions come up. So I think we all get to have an early evening. Thank you everyone for attending. And thank you once again, Seb and Julianne. Great session, very informative. Please don't hesitate to reach out to either ourselves at the PHN or to Seb and Julianne. Have a good evening, everyone.
Right. Thank you.
Bye.